topic I've decided to talk about from Module 2 in the Power Politics in Midwifery is informed refusal. It has been a challenging experience for me now as a student midwife, being challenged, I guess, in the way that I provide care, because as a nurse, it's not very often people ever refuse recommended care, I've found. Because I guess we're in such a position of power and people usually want treatment, but the women I'm looking after now aren't sick, and they're completely in their right to refuse care if they don't want it, as long as they're given all the information. An experience of mine I've had lately is one of my women has refused to let me use a handheld Doppler at my clinic to auscultate baby's heart rate, and would prefer me to use a Pinard because she doesn't want her baby to be exposed to radiation. Basically, I have told her the risks versus benefits of not using a Pinard, and that there's really no evidence to support that there's radiation in Dopplers and that affects baby at all. And I probably more bluntly than I should have told her that I will be documenting everything that we have said in this conversation, and that me using a Pinard, I can't get as accurate of a measure of baby's heart rate, and that no one else really uses a Pinard. And then I a little bit shamefully put it back on her, which was wrong of me. But I said, like, don't you want to listen to baby's heart rate? Like, if I use the Pinard, it's only me being able to hear. And she still said no, and still wanted me to use the Pinard, and that was a really hard thing for me to overcome. And I wasn't annoyed at her, but more like, this is such an annoying situation, I guess, because, I can't hear as well with the Pinard, which is actually not her problem. That my skills aren't good enough with the Pinard, and that's kind of up to me to fix and to elevate my skills with the Pinard, which I have been working on, because I'm obviously doing exactly what she wants and using the Pinard to listen to baby's heart rate, because I am obviously passionate about providing woman-centered care at the end of the day. I personally have not been able to hear the heart rate yet. My senior midwife I work with has, but I have not. But after taking some time with this module and looking back and reflecting on this experience, this woman wanted a completely natural, limited intervention experience, and she actually even wanted a home birth. So not having the Doppler is the only part of this pregnancy that she has been able to have go exactly the way she wants it, because she found out at her morphology scan that she does have a grade 3 placenta previa, so she needs to have a planned cesarean. The whole point of this job is to provide woman-centered care, right? So if that's what she wants, then who am I to take that away from her just because my skills with a Pinard aren't good enough to listen as well. I've been really trying in this topic to utilise the skills I'm learning and all the information from the Module 2 topics, such as informed consent and informed refusal, and resources like the excerpt from the Queensland Health Framework, to try and improve the care that I'm able to give to these women, because this is their journey at the end of the day, and if they don't want me to do something, then I've just got to go with the flow and provide them with as much information as I can so they can make an informed decision, whether I agree with it or not. So I will continue to strive to implement what I've learned during this topic at my workplace, so I am able to keep providing the highest level of care that I can to these women and help them make decisions in this journey.